Good afternoon, everybody. Thank you very much for your attendance. As Ms. Clara mentioned, my name is Shindala. I am graduated from College of Dentistry, University of Mosul, and got the bachelor degree in dental science in 2002 and master in science and orthodontics in 2008. First of all, as we all know, in the world of cars, there are top brands that all of us know. The story is the same in clear orthodontic aligners. We have the Invisalign and the CA clear aligners. Invisalign is a product that's produced by an American company known as Align Technology. This company is established in 1997, and they are claiming that they have treated more than 14 million cases. The other company is known as CA Clear Aligners. This is a product that's produced by a German company known as Shoy Dental. This company was actually established in 1928, but they produced this product that the CA Clear Aligners in 2011. The unique features for CA clear aligners is that between treatment steps, they are going to take an impression or scan, as we can see here, then produce a new series of the modified model. And we can notice here also, in the CA clear aligners, they are going to extend the border of the aligners to the gingival tissue. That's why, because the gingival tissue cannot be predictable, so they need to make a scan or an impression between treatment steps. Another unique feature is that in the same treatment step, they are going to use different thickness of the aligners during the same stage. As we can see here, for example, with step 1, we have soft, medium, hard. It's important to understand that clear aligner treatment is a technique. It's not a product. There is a common misconception that clear aligners are a compromised orthodontic appliance that's only capable of minor tooth movement, or it could only be used for simple cases. However, clear aligners today is a comprehensive orthodontic appliance that's capable of treating wide range of malocclusion. This paragraph from this clear aligner technique book, which is published in 2018 from Quintessence Publishing, and I recommend you to read this book. Now, let's make a simple comparison between the fixed appliance and the clear orthodontic aligners. Let's talk about the force and in the engagement. In fixed appliance, we exert a pulling effect on the teeth, while in the clear aligners, we are going to use a pushing effect. The engagement, the heavier arch wire we are going to use, we will get a better engagement. In clear aligners, the plastic around the teeth, the more plastic wrapped around the teeth, we will get a better engagement. Let me show you this. As we said here, we are going to put our arch wires inside the bracket slot and apply the elastic. So the wire is going to pull the teeth to the new position. And as we said before, the more engagement we get between the wire and the bracket slot, we will get a better engagement. The thicker wire we are going to use, we are going to get a better engagement. While we can see here in clear aligners, as we said before, this is the malposition tooth, and this is our plastic. We are going to insert the aligner and it was going to produce a pushing force to move the teeth to our desired position. And as we said, the more plastic we get around the tooth, we will get the better engagement. Also, another interesting point in clear aligners is the use of attachments. The attachments, as we can see, when we use attachment, the force is going to be applied to the attachment surface. For example, in this figure, this is a finite element study. We cannot, if we are going to apply a pushing effect on the tooth without using the attachment, we are going to get a tipping movement. But when we use the attachment and we apply the same force, we are going to have a bodily movement of the tooth. So, using of attachment is very important. Using aligners without attachments is something like orthodontics, but not orthodontics. This is also a paragraph from Principles and Biomechanics of Aligner Treatments by Nanda. This book was published from Elsevier in 2022. Now, let's complete our comparison. We spoke about the force and engagement. Now, let's talk about the anchorage. In anchorage, in fixed appliance, we are going to have reciprocal anchorage according to Newton's third law. While in clear aligners, we will have anchorage segments may be predetermined. Let me show you what do we mean here. We can also call it selective anchorage in when we use clear orthodontic aligner. In this figure, we are going to see this is the timeline, this is the teeth number, and this is the number of the days. For example, as we can see here, this is the upper arch, as we can notice. Okay. In the first 15 days, I have only the 7s and the canines. The canines and the 7s from the other side is going to be moved, while all the other teeth will be served as an anchorage for this movement. That's why we call it selective anchorage. Why? After the 15 days had passed, other teeth was going to be moved and other teeth will be used as an anchorage. So this is known as a selective anchorage principle. Now let's talk about other comparison features. We have the incisor inclination. We have excellent control for incisor inclination in clear aligners, excellent vertical control, and we have predictable midline correction, and also the two-side discrepancy could be accurately calculated. Let's return again to another textbook. We can see here that aligner-based treatment has proven to be an effective alternative for open bite correction. That's why we said before it has an excellent vertical control. Invisalign, they are going to use a software known as CleanCheck software. This is the software I use to produce the aligners. And as we mentioned, they are claiming they have treated more than 12 million cases have been uploaded to this software. Also, there are other many software that's used for planning clear orthodontic aligners. Which one should I use? Should I use Curvestream, Archform, 3Shape, Blue Sky, ULab, Maestro, and many others? Actually, all are the same. They are only tools to produce what we want to do. It's up to you. You are happy with 3Shape, you can use it. You are happy with Maestro 3D, you can use it. So it's totally up to you. All of them, as we mentioned, they are only tools to produce what we want. If we focus on the main textbook of clear orthodontic aligners, we will notice that most of them will demonstrate and show figures from CleanCheck software. And we are hoping that in the near future, we are going to see more books and more research showing other softwares. As we can notice here, this is the cover page of Journal of Clinical Orthodontics in July 2022. They show figures the same that has been used in Maestro 3D ortho planning software. So, to get an in-office orthodontic aligners, we need to follow these steps. The first step will be taking an impression or making digital intraoral scanner. The step 2 will be treatment planning using your which software you selected to use. Third step is printing the model that has been produced from the planning software. Then thermoforming, and finally producing what we want is the clear orthodontic aligners. Let's speak about each step of them. Okay, this is the first step. We are going to take an image using intraoral scanner. For example, I'm using oral scan 3. An interesting point in this intraoral scanner, it has an orthodontic simulation module. So you can show your patient immediately after making the intraoral scanning, you can show him what will happen if you make an clear orthodontic aligners. As we can see here, this is the teeth after the setup. And this is the teeth before. Also, if you don't have intraoral scanner in your clinic, and you have a lab in your clinic that have desktop scanners, you can take an impression and use the desktop scanners to produce the model that would be used in the treatment software. But if you are going to use desktop scanners, you are going to lose the colors, because these scanners will give you STL file that has no colors, while if you use the intraoral scanners, you are going to have an OBJ file that's rich of colors, and we will see it also in next slides. For example, we have this case that has been scanned using oral scan 3, and it's going to be transformed to the orthodontic planning software. Let's make a fast demonstration on the software. As we can notice here, this is my case. I scan it, and I am going to transform it to my orthodontic planning software. Okay. This case is complaining from some spaces, and also I have a rotation in the premolar need to be solved. So let's switch to our orthodontic software. As we can see here, this is our case that has been transformed to Maestro 3D Ortho Studio. And I'm going to start my treatment plan. As we can see here, what we need to do here, we need to correct this rotation and close these spaces. So let me show you. This is how we are going to treat this case. Rotation, canine fraction, and collapse of the anterior segment. And you can notice here, we used the selective anchorage principle. We didn't move all the teeth together. We start with the rotation, then canine traction, then collapse and fraction of the anterior segments. And as we can see, to make such treatment plan, we are going to need 25 steps, as we can see here. So what I need to do now is to move these steps to my printer to print these models. So I'm going to use this export button, and this will export these steps into separate files so I can print these models, as we can see here. These models has been exported into 25 files that should be printed separately in my printer. So let's return now to our presentation. So as I showed you before, I have the 25 files. I'm going now to slice them to make them ready to be printed. So I'm going to use my slicer software, depend on which software, which printer I'm going to use. If I'm going to use AccuFab, so or L4K, for example, printers, I should use AccuWare or 3D DLP software. This is the AccuWare software. I'm going to slice them and then send them to my printer. This is the L4K, which is an LCD printer. Or if I want to be more productive, I could use the AccuFab D1 printers. After printing my models and they are ready for thermoforming, now I need to make thermoform. So now it's time to pick which material I am going to use to produce my eyeliners. If you are looking for a premium type, you could use the multi-layer sheets. These layers you can make more than single movement in the same layer or in the same step. This product is produced, for example, by Shoei Dental also. Or also, we can, if I am going to use more economic option, but good quality, I could use also tagless sheets. So the other step now is the thermoforming. We can use the pressure type like the mini stars. It's making pressure thermoforming, or I can use the ordinary vacuum thermoforming. And we are going to planning to make a study in our college to compare in difference between these two types of thermoformings. Because there's many companies complain that the the pressure thermoforming is more accurate, and even the patients feel more comfort. So we need more and more studies about this point. Now, after I complete my thermoforming, it's time to cut my aligners, finish them, and making them ready to be delivered to our patient. Then it could be packed in this way. You can pack the modules also, your clear aligners, according to the steps that have been decided in the software, and delivering in the patient to the patients. What I would like to say that, as we mentioned before, in Invisalign you are going to get all the steps printed together. While in CA clear aligners, they, as we said before, each step they make a new scan, make a new design, and print. I recommend to combine the both ways in your clinic, in office, so that you can, for example, you have a case that needs 25 aligners in the case that I showed you before. You can print only 5 and 10, and see how the treatment is going to be progressed inside the patient mouth. If the treatment is successful, you can continue with printing. If no, you can make a new scan, making a new plan, and then you can modify your treatment. Thank you very much for your attendance and for this fast presentation. Now we will open the time for questions and answers.